Good evening, everyone, and welcome to the second in a three-part series leading up to that will lead up to League of Women Voters Delaware Advocacy Day, or as we call it, League Day in April. This particular session is called Opportunities for Success Through Early Care and Education, or ECE. It's not just about kids, and indeed it's not. It's about all of us. My name is Susan Mitchell. I happen to be the chair of the education portfolio for the Advocacy Corps for the State League of Women Voters. And first thing I want to mention to you is we will have a Q&A session at the end of our panelist conversation. So if you do have questions going along, please feel free to drop them in the chat, and then we'll tackle those at the end of the presentations. With us this evening, our three panelists are Madeleine Bayard. She is the Senior Vice President for Rodel. She also is in charge of their policy, government affairs, and communications initiatives. And she is the chair of the Early Childhood Council and a Delaware commissioner on the National Executive Committee and a National Executive Committee member for the Education Commission of the states. Dr. Lisa Lawson is the superintendent of the Brandywine School District and has a career lifetime of providing and supporting programs for our youngest citizens in terms of early care and pre-K in the schools. And Jamie Schneider is the public policy chair for the Delaware Association for the Education of Young Children. She is also a provider with the Educational Enrichment Center in Wilmington. Also with us this evening as moderator is Keda Dorisca. She is also a member of the education portfolio, and she is also a staff member of Rodel. She is their community partnerships manager. So we're going to start out. I'm going to give you a little bit of background information, and then I'm going to turn it over to Keda, who will facilitate the discussion and the conversation of our three panelists. Once again, I'd like to welcome you. I hope you'll stay with us. We are scheduled to finish 8:30. If you also would like to be contacted by any of the panelists or the league, if you want to put your name and your email address in the chat and who you would like to hear from, we will make sure that those messages get through. We are presenting this for on the importance of investing in the education of our youngest citizens. High quality early care and education, which we refer to as ECE, is important not just for the children it serves, but the families who entrust these children to the care of others, and the greater community when these students can finish their education and/or become part of the workforce, economically helping to support our seniors as they age. Research has shown that the first 2,000 days of a child's life are instrumental in brain development. In fact, 90% of brain development occurs before a child enters kindergarten. However, the teachers of these children are typically paid minimum wage. In Delaware, kindergarten is free, but infant care costs families over $11,000 a year, and care for a 4-year-old costs almost $9,000 a year. This expense is one reason why the number of children in Delaware is decreasing. Delaware's child population is a little over 50% children of color. 30, over half of the labor force will be people of color. I've already introduced you to Keda Dorisca, so I'm going to ask her to get our panel started. And I'm really, really looking forward to this discussion tonight.
Wonderful. Thank you so much, Susan. And good evening, everyone. Thank you all for being here again. I just wanted to point out, if you have any questions, please put them in the chat. Please use the raised hand feature so that we can come to you and get your questions answered. Our panelists will share their expertise about the importance of early care and education during tonight's event. This component of the series is to put ECE in context that supports not only the importance of quality early care and education, but also its importance to Delaware's success, economically, educationally, and so much more. Our panelists are no strangers to early care and education or Delaware. They will share the landscape of early care and education, the benefits of affordable quality care for Delaware children and their families, including suggestions for legislative and or policy priorities that would improve early care and education in Delaware, and opportunities to take action. We look forward for an amazing, informative conversation. So please feel free to put in your questions in the chat so we can have a robust conversation. So we're gonna start off with laying the groundwork, laying the foundation around early care and education. So we have a stepping stone for our next questions and as the conversation evolves. I'll pass over to Madeleine and then Jamie and then Dr. Lawson to just share what is the current landscape? What is going on right now around early care and education?
Thanks, Keda, and thanks everybody for being here, and thanks to the League for hosting this event. I'll start really big picture and then turn you over to the experts who can give you more of the on-the-ground perspective. So big picture, there's about 10,000 kids born every year. So if you think about birth to 5, that's about 60,000 kids. In Delaware, in publicly funded programs, we're serving about 1 in 5 of them. So our goal is to get to a place where we could be in a universal system, just like K-12. Kids don't start learning when they turn 5, but school is free when they turn 5. Not only does it turn free when they turn 5, but I don't need to worry about whether my son qualifies for this pot of money or that pot of money, or what did he test into this year, or where do I live, or he has a spot in public school. And so that's not similar for young kids. Young kids with families with young kids have to apply to different state agencies with different eligibility rules and figure out, can I get the state to pay for this part of the day or this summer or those kinds of things. And they also have to find some place that works for them that will take that voucher or state payment, which is often not at the rate of quality. So a lot of our work is around increasing access, getting to more than 1 in 5 kids, increasing access to quality programs where we have qualified teachers and strong programming and good learning environments, and making it more affordable for families. Susan mentioned, but for the 4 in 5 families that are not paid for by the state, that $11,000 number is probably on the low end, and that is per child. So we are nowhere near the affordability mark of the 7% that the federal government says families should be paying for childcare. So I will leave it at that. We'll come back to the impacts on the workforce and parents, but that's kind of big picture landscape. What are we looking at? And I think, Jamie, you're next.
You're on mute. There you go.
Yeah. Okay, now I've completely unmuted. We've only been Zooming for 5 years now, and I still am messing up mute. Thank you, Madeleine. Thank you, the League of Women Voters, for highlighting this conversation and highlighting the importance beyond the care for children. Susan mentioned the brain development, the school readiness, all of the things that I think as a society we've accepted, but there's still the question of how do we fund it and why do we care to fund it beyond just that we know kiddos' brains are developing at the fastest rate they develop in the first 5 years. As a child care provider, I can say that I am a little bit unusual. I always give the caveat that I'm 100% biased about my own center because I went there as a child. The pre-K teacher that taught me is still teaching pre-K. She had both of my children. Our administrators have taught both my children. And I think, though, that that is not unusual in this field, especially in community-based providers. You will see generations teaching generations. And this is a work and passion of mine because I truly believe that developmentally appropriate early care and education that is affordable and accessible to all families is the change that we need to see to really change what our economy, our education system, and our future looks like. And the reason that I say that is the care economy in Delaware is highlighted by us being a great state to retire to. But unfortunately, that also takes a lot of young workforce to ensure that people that are retiring have doctors and nurses and pharmacists and care techs and CNAs, potentially long-term care facilities to go to. And staffing all of those places takes younger people that are potentially childbearing, and getting childcare is next to impossible. I hear from families day in and day out that they have called, 10, 15 centers that are within the mileage that they'd like to drive, that are within what they prioritize as quality, because I think every family may define quality a little bit differently. And really what we're seeing is that while we have 900 licensed providers in the state of Delaware, many of them are operating between 40 and 60% capacity because they don't have the workforce that they need to open those classrooms. So it really is a workforce crisis that we're facing, along with a compensation crisis. And it really will come down to what we as a state prioritize. And if we decide that the return on investment that we know is there is worth the long-term investment to see those returns.
I couldn't agree more, Jamie, and I come from the public school perspective, where we have historically, again, served children at young ages that fall into certain buckets. So if you're a child who has a disability and that's identified early, you're in the early intervention system, and we're swooping you from the birth to 3 system into the public school system. But we can't serve all children. We have been able to incrementally over time serve more children who fall into the realm of what is considered poverty, but that needle has moved to, you have to be in extreme poverty in order to get services at no cost to your family. And so we have tried over the years to increase that, to expand services that we have across the public school system, but have continued to run into walls in terms of a funding issue. And oftentimes we're certainly the ones that where the fingers are pointing that 3rd grade literacy scores are not where they're supposed to be. I agree, they're not where they're supposed to be, and they're not where we want them to be. But we are missing out on an opportunity from birth to 5 to engage as a collective community and do something about it. The research doesn't lie about brain development, and there was a study done a longitudinal study where individual researchers went into households of middle to high income families and households of lower income families. And what they found at the end of that study is that there's a 30 million word gap by age 3 in families that are using a lot of language and cognition, and the 2 parents are working and those kinds of things. And so we know what's happening. We just haven't done anything about it as a state. And it's quite disheartening to have a kindergartner come in, and by the end of kindergarten, we're in tiered interventions and we're needing to do all of this remediation because we have students who just haven't had the experiences at younger ages to get that cognition and that language and the social, emotional, and the motor skill development that other children are able to afford, and that's a pun intended. Their families are able to afford that. We conducted a study. We asked a national research study to look just specifically in our district in Brandywine, but just to throw some statistics at you, we have 1 in 4 students not enrolled in any private preschool, any services whatsoever. We have some particular zip codes that are more significantly not enrolled than others. And those tend to be zip codes that have families who are struggling monetarily and in the workforce. But when they looked, this research company that does national research looked across our state of Delaware, they actually pulled a statistic that half of our children are not involved, ages 3 and 4 years old in particular. And that's distressing for us. In Brandywine, we've seen poverty rates from 2013 to 2017 over a 5-year period increase from 8.6 to 12.4%. So we know that the need continues to get greater out there, and our state continues to not put funding towards what we consider to be a very critical age development time where children should be engaging in some type of school or early care and education. So I'll stop there and we can go to the next piece, but more to come.
Thank you all so much for sharing so much about how the landscape is set up right now, right? I've heard that we're only serving 1 in 5 kids. Like if we're looking in a circle or kids in the cafeteria, 1 in 5 of them is the only 1 in 5 of them is being served. And we've heard about the importance, the legacy and importance of centers through Jamie, and just like the continuation of care. And through Dr. Lawson, we heard about the impact of not having access to quality care and how it impacts the K-12 system. Now, I wanted to ask a question of Madeleine, just to continue to lay the foundation around what is this, can you share about the pots of funds to support early care and education? What I'm really trying to get to is understanding the landscape of like ECAP and POC. What does it mean to pay per child? What does it mean? What is the state agency structure?
I'll try to keep it short and simple. I don't think it's simple. So Lisa talked about school district programs, which are funded for kids with identified special needs. That's one bucket of funding that's from the Department of Education to districts. Another one is Head Start, which is federal money that goes to providers for very few kids. I think it's about 1,000 we looked at, Jamie. So those are 2 pots of funding, just to set aside the 2 primary ones that we think about. One is at the Department of Education, state funded pre-K. Acronym in the past has been ECAP. That's been around since the 90s. And when it was created in the 90s, Delaware was a leader, but we've barely increased it. Some in the last few years, but we're still only serving 1,700 kids across the whole state in state-funded pre-K. And then there's another pot of funding in the Department of Health and Social Services that was established during sort of welfare to work era called Purchase of Care, which is for, so ECAP, the pre-K program, is for kids that are, I would agree, Lisa, are in extreme poverty. You basically have to have one parent working or no parents working to qualify. For Purchase of Care, you can make up to 200% of the federal poverty level, which is the lowest of any of our neighboring states by far, and basically means that 2 parents can barely make minimum wage and qualify. If they make any more, they don't qualify. And so that is out of the Department of Health and Social Services, and it's only for families that can demonstrate they have a work, training, or medical need. So it's really about the parent getting to work and less about the child having a quality continuity of care experience. So one of the things we've advocated for is to simplify that and bring those funds together, more like I was talking about in the way that K-12 brings funds together, to make it easier for programs like Jamie's, to make it easier for families, and then to increase the eligibility so that more families would qualify. But just to give you a sense of those pots of money, they serve very few kids, and they also don't pay for the cost of quality. So they're really paying for a very basic program. We recently did a study, and they're not even paying what it would cost if we looked at what would it cost to meet state requirements. Just basic licensing, minimum wage, insurance, all the things that you have to do to run a business. It's really not even covering that. So we know that, we have a lot more to do to increase the investment, both in quality and to increase the access and the number of kids. And ideally to bring those 2 agency structures together, like 22 other states have done, to make it more streamlined. So I hope that helped with your question, Keda.
Yeah, definitely. Laying the groundwork. It's like, what are these different pots of funds? What do they mean? Who's qualifying for them? What really are they supporting? Jamie, I wanted to head into the impact, especially focusing on our educators, around, you know, what is going on with our educators? What is their experience and what is happening on the ground for them, educating, but also needing those resources and having to make some tough decisions, whether to increase their pay or lose what they have?
Kate, I think this is a great question. And Madeline, I just will say, when you said, could you simplify that and do it quickly? I think that was an excellent overview of the funding streams. When it comes to early care and education, there are some things you can do without, but there's one thing you absolutely cannot do without, and that is those educators that are in the room with the children. Delaware has pretty impeccably strong regulations that we should be really proud of, because we do lead the country in what we expect of our early care and education facilities. But it also provides challenges. And some of those challenges include meeting ratios. I need one adult for every 4 children under 12 months of age. That's incredibly expensive. Across the board in the state, staffing costs are between 60 and 75% of your overall budget, which thankfully we saw an increase to minimum wage here in Delaware, but that had a huge impact on budgets across the board when it came to early care and education, because not only did we have to elevate the wages of everyone that was entering the field, we had to elevate the wages of everyone that was already in the field so that they would be willing to stay in the field. There is not an easy day in early care and education. Every day is different. You have children that are having good and bad days. You have parents that you're dealing with that are having good and bad days. And so it is a stressful job. It takes knowledge. It takes knowledge of development. It takes education. It takes continued certifications. And so as we continue to increase our expectations of teachers, we have not increased the ability to pay them in the same rapid increase that we have with the expectations of them. And so it becomes a huge challenge. I know of, if we don't count large nonprofits that have multiple funding streams going to them, I know of 5 private owner-operated centers in the state of Delaware that offer benefits. I am very lucky to be one of them, but that is also because the 2 former owners were very advantageous in the early 80s and put benefits and healthcare as part of their compensation package so that they were able to do that. I've also am very lucky that for 44 years we've been in the same building. And that has been incredibly helpful. But I also know that when people say, well, just add healthcare, for that, it's usually about $500 per employee per month. So if you guys can do the math on that, depending on how large or small a center is. For a family childcare provider, though, that's probably looking closer to being between $900 and $2,000 a month, because they have to support themselves on the ACA, and depending on their age and any other healthcare status that they have, it is incredibly challenging to get that coverage. And the only way that we have to make up that coverage is if you're a nonprofit provider, you may be able to fundraise. If you're not, it is directly turning those increased costs to your families. And that can mean upwards of 12 to 20% increases over the course of 2 to 3 years, which we know for families, regardless of income, is incredibly challenging. I think the other piece about this is really important. And as of 2022, I believe it was, 67% of the early care and education workforce had 2 years or less experience. That is baffling. Even as a provider who's seen it, it is hard to train, it is hard to continue quality, and it's expensive. Staff turnover is incredibly expensive, having to put in hours of training and orientation and all of the things. The other thing that's important about that is it is only trauma second to the death of a parent or close family member is losing a teacher before the age of 5. So the impact of lack of continuity of care on young children creates trauma that we can only repair by creating consistency, which is really hard to do in a field that is unstable. So I think when we make these decisions, developmentally appropriate care is absolutely one of them that must be part of it. But we also need to recognize what we want our workforce to be, how we want them to be recognized, and the importance that we put on them, as they really are the people who are having the greatest impact on the future of our children. Keda, I hope that answered the question.
Yeah, the importance of our educators in early care are vital to our earliest learners. Investing in them is investing in our kids also. Dr. Lawson, I wanted to ask you really quick before we move into the workforce piece of our conversation around the impact that this is having on K-12. You mentioned it earlier about, the more resources that's needed. I was wondering if you could expand on that and also tie it back to how important this is for your district.
Sure. And unlike Jamie, which, unfortunate, it is unfortunate, we don't have the kind of monetary impact that she's seeing around having to pay the workforce thanks to labor unions, right? There's a teachers union structure for early care and education providers. So if you're a preschool teacher in the school system, you are getting competitively compensated for that. But we are seeing shortages in the public school system as much as Jamie is seeing in the early care workforce as well. We do have vacancies that we can't fill. We believe that certainly the media and society are contributing to people not wanting to go into public education anymore. It is not a scary place. It is a highly rewarding profession, always has been. And yes, did COVID harm many families and children for having to sit behind a computer screen for 18 months? Yes, it did. And did we have a hard time getting students socially, emotionally readjusted to school? We absolutely did. But we hopefully will never have anything like that occur again. But we are seeing staffing shortages, staffing turnovers, those kinds of concerns, especially in the realm of special education in the public school system. But I would say the biggest impact besides the workforce is the impact on children. Without high quality early care and education prior to the public school system in the birth to 3 realm, we're seeing more children who are not getting through their developmental screening, meeting milestones. And so then they're being referred for special education and related services in the school district. And I think families who are impoverished and are struggling in the workforce, finding a job, there's substance misuse challenges, and then the effects on their children. And so I think that it's a domino that continues to fall because Delaware's not wrapping its arms around this population and this workforce and saying, we've got to do something and we've got to make sure that we intentionally put money in this place to be able to not make it worse.
Yeah. Thank you so much, Dr. Lawson. The urgency has always existed, but more now than ever. We need to do something. And we need more investments in our educators and our children. There's a question in the chat, and I wanted to jump to this before we move on to the next pieces. We have a question from one of our attendees. It sounds like the single most limiting feature of the early child care system is too few workers. What are some potential remedies? And I'm going to open this to the panelists.
Jamie, you want to start?
Sure. I'd actually like to point to the pandemic, actually, to show what paying the workforce can do. So when the pandemic hit, very quickly, Governor Carney recognized the importance of early care and education, to keep workers being able to go to work and also ensuring that our kids were safe and healthy. And what he did was invest over $200 million into early care and education in basically a year. And that money was specifically driven to go to the workforce, and it kept people in the workforce. It kept them paid. It kept them whole. It kept them going to work. It kept them engaged, and it kept our kiddos. It gave them a sense of normalcy, that was something that they were looking for in this world. So I hate to say this so simplistically, but the way that we can do this is by investing in our workforce. I have heard a lot, and I don't want to disparage any governors that are local to us, but the state of Pennsylvania is giving out $1,000 retention bonuses in childcare. Delaware did that 4 years ago. Delaware did stabilization funding to ensure that we're there. But what we don't have is long-term sustainable revenue to support paying and investing in early care and education. And that truly, we have to take the burden off of families and just say that if you either have to be really poor or pretty well off to afford childcare, and everybody in the middle is sort of stuck. And we need to take that burden off of families, and we need to say and really look at ourselves as a state and say, are we willing to invest in this? How can we increase the revenue to do that? And is it something that is universally supported by our taxpayers? And I think we have the evidence to show that it is. I think we have other states that have made this a priority and are starting to see that return on investment. And I think that that really is the remedy, is just ensuring that our workforce is paid what they are worth.
I would just add, I agree with all that. And there have been a bunch of efforts to kind of recruit folks into the workforce, give stipends, give scholarships, specifically recruit people to advance in the workforce. There have been efforts over the years to do apprenticeships. Now there's a focus on kind of getting your entry-level credential, the CDA, and getting an AA and a BA while you work and get paid while you work. But part of the challenge there is what Lisa described. We have people who get their BA and then see the public school system where they can have benefits and have summers off. And so why wouldn't I go, if I still want to work with 3 and 4 year olds, why wouldn't I go work there? So really, until we get to a place where, there are similar pay, compensation overall, and benefits, we're going to constantly have this churn. And we hear it constantly from providers. And that's why I think one of the reasons for the 2-year tenure. Lisa, what would you add?
I would say that's spot on, and certainly it's never our intention to take, right, your best and most trained, and that's why if we're not all working together as one big collaborative group, we're going to see this continue to happen. And it is unfortunate because we need high quality providers that are compensated appropriately in early care and education, because the school districts can't take on all the students. It's going to have to be a partnership with public and private together, working together.
Keda, if you don't mind if I jump in real quick, I think that it's really important. We've talked a lot about school districts and center-based care, but I want to remind everyone that center-based care also means over 400, mostly, if not all, women, many of color, who have family childcare in their homes and open their homes to children, between 6 and 12 children a day, depending on what they're licensed for. And that is really, they're the only providers providing off-hour care. So if you work something that is more than really 7 to 6, you can't find childcare in the state of Delaware. There is no option. And it is these family childcare providers that really keep their overhead so low, basically because they don't pay themselves, that families who are in that low to middle income, which honestly can be 2 first-year teachers in some districts, that can't afford childcare, we need to ensure that we continue to elevate them as part of the conversation, because I think that that is a piece of the workforce that is kind of continuously, not by any means respected but underrepresented because many of them probably are still working right now, or cleaning up or prepping for tomorrow, and often can't be part of the conversation because of that.
Thank you for calling that out, Jamie, because that is really important to call out, like, there's a traditional hours and there's a non-traditional hours, and the different deliveries of early care and education throughout our state. I wanted to transition a little bit to around the benefit of affordable quality care for Delaware children and families. Rodell did a survey in the fall that got some really alarming results from families and children, and from families with children and providers, around the impact that they're having around the lack of childcare and its hindrance essentially around Delaware's economy and economic mobility for parents. One of the statistics that we saw were that Delaware families want to improve their situation. Respondents said that if they could find and afford childcare, they would work or increase hours, go back to school, buy a home. So this is not, as this session's name is like, this is not just it. There's so many early childcare impacts so much more throughout our state. So I wanted to pass it on to Jamie, Madeleine, and Dr. Lawson to really, like, if you could speak to the impact that you're seeing with Jamie, if you could speak to the impact that you're seeing with families, of like just around early care and access and getting into childcare. And Madeleine, if you could speak to some more results from the survey that were a little alarming and jarring. And Dr. Lawson, if you could tie it back to just what you're seeing as you are stepping into this place also.
Keda, yes. Also, that's a big question. And I think a lot goes into it. And I think, one of the spaces that I really continue to think about is not what would it mean if families that I serve or families near me were paying less or had more affordable access to care, but also recognizing that there are areas in the state where you may have to drive 30 to 40, which, let's face it, driving 30 to 40 minutes in Delaware seems outrageous because we're a small state. But in Western Sussex County, there's a zip code that has one child care provider that is center-based, and 2 family child care providers, and no after-school programs. So while I know this discussion is really focusing on birth to 5, I think we also need to just keep in mind the burden that child care has on children. We'll pretend that it's ages 13 and up, but the childcare impact on children that are 10 to 13, whose parents rely on them for after school care of their younger siblings. But I think the other piece to this, and this will sound jarring, but we had a family that just left us, who are doing well for themselves. Dad's a teacher, mom's an ER doctor. And during the pandemic, their choice was, does dad stop working and take all 3 of the children? Or do we pay for childcare for all 3, which was a pre-Ker, a 2nd grader, and a 4th grader? So they had the budget did not include paying for care for 1 year for the 2nd and 4th grader. They ended up paying $54,000 that year in childcare. That's basically probably dad's salary. But he also recognized that for his mental health, he needed to work and not be completely burnt out, and that they needed access to care when mom was called in at unknown times or off shifts or was just basically living at the hospital. And when they calculated over their 14 years of being at EEC, how much they could have returned to the economy versus paying for childcare, no one ever tells me they're going to invest in their Roth IRA. No one says they're going to put this money into savings. Families get new cars as soon as they get out of childcare and enter public school or even private school that's cheaper than childcare. They will buy second homes if they're able to. But the other big thing is, for my workforce, when I see big differences, they all get new tires. They'll get a new car. they're able to buy that washing machine that they've been putting off buying for a really long time. And I think that those are the investments that families that are just on that cusp of being able to afford care and being at the poverty level, those are the investments that you'll see is they'll be able to do better for their homes and their lives, which is absolutely important that if for 1 month they don't have to question, do I need to pay for groceries or gas? Do I have to float the gas bill because we paid it last month, but we need a new tire, or somebody needed to go to the doctor and that medication was more than we expected? I don't think that anyone recognizes that regardless of most income levels right now, families are crunched. And most families in the country are one paycheck away, or three paychecks away from real catastrophe. And so I think the other thing is that we always say if there's a high price tag on childcare, like the families must be fine. The amount of family members that have someone else assisting with care is huge. We have grandparents, aunts, uncles that support their children because they know that this is an important decision and that they want their child in the center that they choose, regardless of cost. So I think that we have to look at this from a what is best for children, but also what is best for our families. And I think that reducing the burden of childcare only turns around our economy and puts that money back into the economy, and really elevates our state to a different level of access and affordability to all kinds of services. Because when there's more childcare, there's more workforce.
I'll just add to that. The survey that Keda mentioned, we had families saying that they do not recommend living in Delaware with children, and 1 in 5 have considered leaving Delaware because they can't find childcare. We have heard about multiple doctors who have committed to moving to Sussex County, which we know is a need, and then decide not to move and turn down the job because they can't find a place for their child to be. So we know this is impacting the economy. Parents are saying they're skipping meals, they're going into debt. The statistic about women dropping out of the workforce, losing about $250,000 over the course of their lifetime and career, honestly seems low to me when you think about what you're putting into your retirement and your career advancement. But that's what the latest national statistics I saw was. So most Delaware families are saying they can't afford it, and if they can afford it, it's even still hard to find, like Jamie mentioned, and even harder for children with special needs. So we know it's having an impact on families, and they're turning down promotions because if I make that $1 more, I'm going to lose out on my benefit that is a value to me of $15,000. So they're forgoing their own economic mobility because of this benefits cliff they face.
I would just add that we're seeing it as well. And to Jamie's earlier point, we're seeing it, past the 0 to 5 ages. We had an extremely high quality teacher who was just excellent at what she does, actually resign because she had a 3rd child. And then by the time you pay for multiples, your salary is already gone and then some. And so you're seeing 2-parent families choosing to become one working parent family and the other one staying home because the cost of childcare exceeds the salary, which is what Jamie had mentioned before. So we're seeing the same kind of impacts across the school system once they start school and have that free coverage from 8:30 a.m. to 3:30 p.m. That wraparound piece is really important for some families. And I'm glad you remembered to lift up our family childcare families, Jamie, because my own granddaughter's in a family childcare. And then when she's sick or the family childcare provider is sick, it's the rest of us around who's taking the day off, who's got her. Like, it does become a village for each child. And sometimes it just becomes overwhelming for families. So they have to leave the workforce.
Yeah. Thank you so much. I think it wraps up to what Jamie said earlier. The more childcare, the more that we can invest in our workforce, the more that our workforce will build. And creating these spaces is so vitally important. I wanted to skedaddle over to what do we do now? we've talked about the landscape, we've talked about the experiences that our educators are having, parents are having, how it's impacting Delaware's workforce and economy. So where do we go from here? What's the next step? I'll start with you, Dr. Lawson, do a little reverse Uno, and then we'll go to Madeleine and Jamie.
Well, money, right? I mean, Madeleine and Jamie and I have served on task forces and committees for a very long time, as far back as, I was thinking, when was the first one where the governor was involved, the Secretary of Ed? It was a collaborative effort. I think it was 2008. We've got to find that consistent funding stream. And we've looked to other states. We've had experts from other states talk to us about how they established that funding stream. What is it that they went after? Was it a particular tax on soda or gas or liquor? We've been through multiple conversations, even as close as New Jersey. They went through a circumstance in their state, and now they do have universal pre-K for 4-year-olds, and there's public-private partnerships. So other states have figured it out. I think states have done things differently, but really it's to what extent can we come together as public and private and say, we're committing to this, we're going to establish this funding stream, and it's going to happen for Delaware. We've just swirled for far too long.
Yeah, and to do that, that requires elected officials hearing from their constituents. So I think Keda is going to talk about, how you can get involved, find your legislator, contact your legislator, but really it's about, putting pressure. There's an argument for everyone. If you believe in reducing crime, early childhood. If you believe in better long-term health outcomes, early childhood. If you want 3rd grade reading, early childhood. If you want the nurses, Jamie talked about, you got to invest in early childhood. So there's usually an in. Some legislators have been in early childhood themselves or have been clients of purchase of care themselves. So there's usually a connection you can make. And I know Kate is going to talk about how to do that, but that is really where we are. We need to, as a state, make the commitment to invest more.
I would completely agree with both of those sentiments. And Madeleine, yeah, that I think that early ed is actually like the great equalizer. That if we invest that $1 and we get that $9 return on investment, like that's really what we need to be working for. And I think I've heard said, I didn't make this up, we either invest now or we pay later. So we can either invest in our children birth to 5, or we can pay for services that are needed in K-12 and beyond, because our children aren't ready. And I don't mean that. I just want to also be really clear. I believe in reading scores. I believe reading is fundamental and part of long-term success. But I also know that childcare, birth to 5, early care and education shouldn't be a watered down version of 1st grade or 3rd grade or kindergarten, and that we need, and I know Dr. Lawson, you brought back play-based learning in elementary schools in Brandywine School District. And I think we need to ensure that we are providing the delivery of childcare and early education that families want and need, and meeting those goals that we have, because we know that it really just is the high quality interactions between an adult that truly set kids up for success. And I remember hearing a study that was of the top Fortune 500 companies, and they asked their HR departments what new hires were missing. And none of them, in the top 5 things of what they were missing, none of it was content level expertise. Like, it was easy to find a workforce with content level expertise in any field. What they didn't have was the ability to problem solve, communicate, work in a group. Some of them even self-help skills, like they were going to HR and saying, like, I don't know how to get a bank account, which I'm not saying we teach kids at 3 how to get a bank account, but we teach them how to tie their shoes and take care of their personal needs so that when they get to kindergarten, they can start that next process of social emotional development and learning along with the academics. And I think that it is vitally important. And I will say that this also comes from Dr. Priscilla Impasi at Christiana Care. You can tell me this is a priority, but until you show me your budget and it's included, it's not. And that's really what it comes down to, is if this is a priority, we as a state will work with our agencies, administration, and legislators to ensure that we have the ability long term to meet the financial needs that this will take.
Thank you so much. Vitally important. Like, it goes back to investments. It goes back to, we need to take the next step collectively and take a strong step in advocating to our legislators, our governor, to make the changes necessary. I'll go into some next steps in a bit, but there are some questions in the chat that I wanted to ask. The question that we have is, are there any states that you consider to be a role model for early care and education, and why? I see you shaking your head, Dr. Lawson, so I'll go to you, and then I'll go to Jamie, and then end with Madeleine.
Well, it's just, and Jamie and Madeleine were both on the committee that Lieutenant Governor Bethany Hall Long hosted us on, but we looked very closely at New Jersey. We looked closely at New Jersey because they chose to enter into a public-private partnership. What we don't want to do is have our family child cares, our centers, our licensed care centers close. We want to see them thrive. We need them all and then some to serve all the children of Delaware. And so we were particularly interested in that model because it was a partnership where public and private came together. There was an influx, an infuse of a great deal of money. It was unfortunately done through a lawsuit and not a collaborative means. We were not asking to go that route, but I think we looked at that one pretty closely. I'll let my other two colleagues jump in if there were other states that we were particularly following more closely than New Jersey.
You want me to go, Jamie?
I did, yeah.
So New Mexico, DC, Virginia, Vermont have all in the last couple of years committed to covering most kids, if not all kids. And they've moved to, like we were mentioning, we're at 200% of the federal poverty level. They've moved to 575%. So they're increasing, gradually who is eligible for these services. New Mexico put it in their state constitution that this is a right for children from birth to 5. So there are a lot of states to learn from. All of our neighboring states and all of New England serve more kids in state-funded pre-K than we do. And they also have higher eligibility thresholds for people to qualify for subsidized childcare. So there's a lot of learnings that Delaware can be taking from other states, but they do require investment.
And I'll just jump in and say those states then outperform us when it comes to, you name it, NAEP scores, SAT scores. And so there is a correlation between the states that have invested in their early care and education and then the outcomes for young people.
I have no notes, Keda.
All righty. Well, thank you all so much. It's important that we continue to learn from other states that have done this work and have done it well, so that we can avoid some of the pitfalls they've had and strengthen a system that supports our kids throughout the state in getting the early care and education that they need and deserve, as New Mexico made it their right to receive that. I just wanted to see if there was any last words before we jump into advocacy, and give you all an opportunity to give any last words. And if anybody in the chat has any if anybody in the room has any questions, you can put it in the chat and or raise your hand with the raise hand feature at the bottom of your screen.
Sorry, Keda, were you giving us also the opportunity to make final remarks? Okay.
Yes.
Well, I will say that I am never shy to talk about this topic. I would happily love to engage anyone after this meeting in future conversations. Keda's going to talk about how you can get involved in early ed advocacy. But I think, one of the big things for me that people don't often recognize, like how big the cliff is for benefits in early care and education for families. When we went up to $15 an hour for minimum wage, that basically wiped most families of 4 with 2 working families out of eligibility for subsidy. What that meant is those families likely went from, if they had 2 children, likely went from paying somewhere around $375 a month to paying upwards of $1,300 to $2,700 a month. That is not able to be made up. We know that an increase of $2.50 an hour is about $5,000 a year. These are decisions that families are making, that we, especially in early ed, have a lot of our workforce that comes to us and says, I can't take this raise. I can't take another 25 cents an hour, because it will end up costing them tens of thousands of dollars on the back end. And that's not even to talk about if they would lose their housing or if they would lose their health care. That's just one subsidy, and it's the largest cliff. And I would say that increasing our eligibility is something that we have to do to stay competitive in many ways, but it's also something that we have to do because it's right. We know that families, when they're desperate, are making desperate choices, and that leads to children being in less safe environments. It leads to more harm. It leads to more potential predatory behaviors happening. And this is not because parents want to, it's because they have to. When the choice is go to work and feed your family and then rely on someone else to watch your child that you may not be comfortable with, that's a really tough decision to make, but it's also one that we as a state need to really decide that this is our priority and that we need to ensure that we put our most vulnerable citizens at the forefront, which is really those kids birth to 5. Because if we don't give them an equitable chance, they're not going to have an equitable chance anywhere further. And so I think that, as we've all said, this is the great equalizer in so many ways. But it's also that we have the option to act or to continue to sort of kick the can down the road, and make some Band-Aid choices, or really make investment now that'll impact our children immediately and for the future. Kate, I do see a hand raised. I don't know if everyone can see that because my screen is a little bit different than I'm used to.
Yes, there is a hand raised. And Keda, I was going to suggest maybe we go to the questions first and then end with the advocacy part and what you can do or what we can all do, because I know everybody on this call is going to be ready to do something. So is that okay? Can we do that? Because this has led to several conversations and several things in the chat. And I know not everybody can see. We've been getting questions sent to us as individuals. Let me take a look here, because I've been trying to copy and paste it into a total document. Some of the questions I don't know if we have the time tonight to answer, but I'm going to move to this. One of the questions was kind of what is keeping us from moving to some of these models that exist in other states. I mean, I'm blown away by what Madeleine shared about New Mexico. What is in the way? What historically has been in the way? I come from a high school teaching environment, and I know that equity has always been an issue, but it seems to me that equity is really the issue in early childhood. Can anybody, comment on why we haven't been trying to pick a model that maybe could be used here in Delaware? It's the money again?
Well, I have a couple thoughts. I mean, one is when I moved back to Delaware almost 20 years ago, there were still legislators then saying, childcare is spelled MOM, kids need to be at home. Like, the societal belief had not caught up with the brain science. I would say that now that generation, the older generation in Dover, sees their own kids, our generation, suffering and understands the issue and no longer says, Childcare is spelled MOM. They know that most parents are working. They know that this is a challenge. They help their kids because of these challenges. So I would say that is one step in the right direction, that now we're not convincing most people that it's an issue. It's convincing them, do they want to bite the bullet to, find the revenue source to pay more? And some of that is leadership. And some of that is just, committing to probably a new revenue source for the state or an expanded revenue source for the state. But what would others add?
That just is it a sales tax? Is it property taxes? Is it soda, liquor? I mean, there has to be that steady stream. Jamie talked about, when we get one-time funding, that's not going to do it. We have to commit to something as Delawareans and say, this is important to us. And you look at what we pay in property taxes compared to our neighboring states, it's not even close.
Mm-hmm. Christy, Gilleen, you have a question about the governor's focus on ECE. Do you want to ask that question?
Sure. Hello, thank you all for attending. We really appreciate your perspective. I had two questions. Can I ask two, Susan?
Oh, I guess.
Okay, well,
Yeah,
the first
of
was
course you
Madeleine.
went.
Madeleine, would you go back to when you were describing the support system in terms of the legislative structure? You mentioned that most states, early ECE is under one department. In Delaware, it's under two. I think that's a critical piece for the audience to understand that we are one of the very few states that still splits this. And I'm from Pennsylvania. I'm a former early childhood teacher, kindergarten teacher, principal, worked with Governor Rendell, sent me to Delaware to learn about the 5-star program. And it was something that we adopted in Pennsylvania. And I'm sad to hear and realize moving here, you haven't moved very far. And so can you talk about that structure, the legislative structure? And my second question was, I really wanted to hear more about Bethany Hall Long had Lisa, you referred to a forum or whatever, and there were recommendations. Why did that stop? Who didn't listen? Because we have a governor that was elected on a platform that he believes in early childhood care and universal child care. And there's nothing that drives him crazier than a constituent saying it's been kicked down the road and here's evidence that it has. So can you elaborate on those questions? Thank you.
Oh, Christy, the hard ones.
Yes, you count on me for that. Yeah.
Yeah, thank you. Yeah, I mean, part of the movement, I think, with the agencies is us catching up with that mindset that this is actually about child development. Yes, it's about parents working, but we're still stuck in this mindset that parents have to not only prove their poverty, but then they have to prove that they have a medical training or work need. This is about, we know what's best for children's development. And so part of it is that mentality that we're still stuck in that sort of federal mindset of, let's help get people to work rather than thinking about it as child development and family support more cohesively. So we need to catch up with that. I guess it could be legislative, but really it takes a leader. We've seen governors do that kind of either create a new agency devoted to early childhood or typically move kind of the subsidy into the agency that deals with education to create more seamless transitions like Lisa mentioned. So ideally, that's what a governor would do, both commit to one of those revenue strategies that we've talked about and learned about previously, and also kind of consolidate the funding streams to maximize them and streamline it for programs and families. Lisa,
So Madeleine, do you think it would be to the advantage then of promoting change here in Delaware that we would advocate with the current governor and the new Secretary of Ed to move in that direction?
Mm-hmm.
So
and
that's
the kindergarten teacher, so I'm very hopeful that we're going to be able to move this needle. But Christine, it's such a good question because we actually used to be spread across 3 agencies.
Oh my gosh.
The Kids Department, the Department of Ed, and Health and Social Services. And I thought to myself when I first got into education, how in the world does a family navigate three
Yeah.
different agencies. And then Delaware chose to leave it that way. I remember being at a 6-state forum where we said, no, we're all working together inside these agencies and they meet on a regular basis. And then they weren't meeting on a regular basis. And it just, it doesn't work. I hope that time has proven that and we can start moving towards more integrated approaches because it has not been helpful.
So would you agree, the panel agree that a focus of our advocacy should be pressure placed on the governor to live up to his campaign promise and the influence of his new Secretary of Ed, who seems to be very pro-education? Would that be a good route to go?
I would totally agree with that, Christina. I would also say that I think it's important because the second part of your question was we were all part of a group and why hasn't more been done? I think there may be still disagreements in some of the details and the weeds and all of the things, but I think the big picture has been fairly agreed upon. And now it's just a question of, and I don't think there's a chicken or the egg. I think it all has to be done at the same time. How do we fund it? Where do we get the workforce? And where do we get the space? And those are the three things that it's like, even if we had the magic wand and we got all the funding that we needed tomorrow, it would still take those paths. And I think that unfortunately we live in an elected official system where you have 3 years to do something because you have to get elected again if you're governor.
Yeah.
If you're in the Senate, you have 3 years to do something because you have to get elected again. If you're in the House, you have 1 year, one before you start running again.
Yeah.
And so we continuously have to sort of have that bright, shiny object that you can put on a campaign placard. You can send in the mail, I did this. And early education really isn't, it's not legislation. It's not gonna be bright and shiny and real like, woohoo, we did it for a few years. And those few
Right.
years might be another 8 years until we really see the return on investment. And I think that that is just something we have to continue to both remind ourselves and our elected officials about, that this isn't just what are you doing to put something on your next campaign promise or how you're going to win your next campaign, but really are you doing what you came here to do with an intent to make Delaware better for the future?
Jamie, I think that's an excellent point. And I live in Sussex County and my representative is Dave Wilson. And I have been having conversations with him for the last 10 years that I've lived here about early care and the need for it. And he was, Madeleine, one of those mom kind of guys, well, mom should be there at the farm and, and I am proud to say he stopped saying that to me. And he is proud to say that he recognizes that because his grandchildren don't have anyone to care for their kids, so they can still work the farm. And so I think there is an opportunity for change and for engagement, and we just need to continue to hammer it away. But I really think it's about the perspective, particularly in Sussex County, but it's also about demanding what's right for kids. The first filter should be, is it good for kids? As is the last filter.
I did put in the chat if there were any more questions that you could feel free to raise your hand. And I don't see any hands raised. So Keda, if you want to talk about activism and advocacy, and then I'll just give a couple of closing remarks before we finish up.
All right, perfect. I'm going to share my screen with everyone for you to be able to see. I know Jamie's seen this already, and so has Madeleine. But it's very important that we continue to share it, continue to elevate it. Can everybody see my screen?
Yes.
Perfect. So I'm going to talk a little bit about the Early Childhood Advocacy Coalition. It's one of the spaces to get involved around what is happening around early care and education. These are a few people that are part of the coalition, but I want to make sure that we're centered around what the coalition is. It's a coalition of partners that's focused on expanding access and publicly funded to publicly funded high quality early care and education in Delaware. So we want to bring parents, providers, advocates together in this coalition to continue to advocate and move the needle forward for our kids, for our children to get the access that they deserve. I know this was brought up earlier around the agency changes and the leadership changes. Our Secretary of Education is Cindy Martin. Our Secretary of Health and Social Services is Josette Manning. These individuals that I'm going to go through the next 2 slides are the legislators that sit on Joint Finance Committee. They help to finalize this budget that determines where money is being spent and where it's being allocated. If any one of these legislators are in your district, please share. Please advocate to them. That is one of the steps in making sure that it is front and center in their minds, but front and center on the balance sheet. These are the House members. And then I'm going to go into the budget cycle. Right now, we're in the February budget cycle, where last week and the week prior, we had parents, providers, community members share and give public comment as to why early care and education was important, so that our legislators that are part of the Joint Finance Committee can take those remarks can listen to those remarks and listen to the impact of early care and education to be able to make those decisions and prioritize funding for early care and education. March through May is where we're going to have ongoing discussion. It's ongoing advocacy, and it's very important that we are continuously advocating during this time, that we are not resting, but we're constantly communicating with our legislators, constantly elevating the voices of parents and families. In May and June, the Joint Finance Committee meets and finalizes the budget to align with final revenue projections. So we need to take this time right now to be urgent, to advocate, and to make sure that this is top of mind for every single legislator and our governor and lieutenant governor. Now we're going to go into opportunities to engage. Did Lisa, Madeleine, or Jamie want to say anything about the timeline or advocacy before I move into opportunities to engage? All right. So opportunities to engage. There are 3 things that you can do today. There are 3 things you can do. 1, you can send a message to Governor Matt Meyer and the Joint Finance Committee, and we'll put that link in the chat for you. So it's a pre-filled form. You're able to add your personal message into it, and you can send that email straight to them. And the tool that you're using is our online tool called Voter Voice. And in that message, it'll go directly to them, where it has what our ask is for this fiscal year is for investments. So it's there, it's available for you to utilize. And I always say, don't keep it with just yourself. Take it and email it to 5 other people and tell them to send a message also. As we know, the more of us that are coming together, the more voices that are saying the same tune, and the more people that are sending messages, it can't be ignored, the need for more investments. Here it is right here. You can always take a picture, and we can put the bit.ly into the chat for you. These are our asks for this legislative session, and we can also send you the 1-pager that you can share too. As I said, share with five more people. Put it on your Facebook. Put it on your Instagram if you have one. Share it with the people that are in your community. Second thing that you can do is reach out to your legislator. Christy shared this. She has been reaching out to her legislator for the past 10 years. Like, we're seeing him have a perspective change. Continue to reach out to them. They serve you. You elected them. Whether you voted for them or not, they serve you. So continue to reach out and continue to figure out who they are and what you can do and how you can continue to meet with them so that they have this top of mind. We do have some tools that you can use for these conversations. The dossiers that we first of all, connect with your legislator, going on the legis.delaware.gov website to find who your legislator is if you do not know who that is. Some tips is targeting the ones who represent your district. We always tell providers where you live and where you work are vitally important, because you might have 2 different people that serve you or the same person. So double whammy, or 2 different people that you can connect with. Tell your story, but also something another advocate had shared on our early childhood advocacy call is understand, just hear from them where they're coming from. are they still thinking that it's mom's job, or what are they thinking in terms of early care and education, so that we can level set and see where they are, so we can start to churn and change that perspective. Provide data. We know that our legislators want to hear our stories, but they also want to hear the data to support them. If you know any providers that would love to have a site visit, please don't hesitate to let us know, because we can support them with coordinating one. So additionally, there's upcoming coffees that are throughout our community that we encourage community members to attend. In Wilmington, we're going to have Stephanie Bolden having a coffee. We're going to have a community meeting happening in Representative Cindy Romer's district and and Representative Mara Gorman's district. And I believe legislators are also having coffees. Representative Ron Gray and Senator Gerald Hocker are having coffees, and also Danny Short and Representative Kevin Hensley. So if you can make any of these coffees, please do. We want you to, and let us know so we can coordinate with you. These are the dossiers that I was talking about earlier. This is where you're having the data, and then you're also having the quotes from families and providers in their district, sharing how important childcare is for them, but you also have the data around family childcare and childcare centers within their districts. And this is a tool that Jamie had alluded to earlier around showing how childcare is being balanced within the different professions within our state. Like, you have two parent household, 2 teachers, and you see that childcare, they can't afford childcare either. You have a teacher and a construction worker cannot afford childcare. So you're able to use these data points as talking tools with your legislator, and also community members too. This tool is the next piece around accessibility and eligibility. As you can see over in my right corner, maybe your left, where you're able to see where we sit amongst our neighboring states for eligibility, and seeing that image is drastic. I shared it with a parent over the weekend at 302 Day in Wilmington. They were shocked. And the one question that came out of her mouth was, why are we not providing what our children need? Why are our legislators taking so much time? What is happening? So sharing that image is so vitally important. And also the additional statistics, right? 80% of children are without access to publicly funded early care and education programs. Why is that? We can make a change. We can make the difference. And then the third piece is attend Advocacy Day. I know that the league has League Day on April 8th, but I'm gonna go straight to that. Another piece to support early care and education is attending early child care Advocacy Day happening on April 10th. On to my next slide. Upcoming events. League Day is on April 8th in Dover, and I know that Susan will share more information on that. Early Childhood Advocacy Day is happening April 10th at Dover Library, and then we'll go over to Legislative Hall for meetings. And then another upcoming event is the Connecting Stories and Trauma-Informed Networking. That is going to be focusing on early childhood and first responder workforce. So we always invite in as many community members to attend these events, so that they can continue to share why early care and education is so important, and then also advocate there. All right, that was my last slide. Sorry I rushed through it so quickly. We will send these additional resources to you. But before I ended, I didn't know if Jamie or Madeleine or Lisa wanted to share a little bit about advocacy or their experience with advocacy and the work that can be done within our community. And that it does work. It does matter.
Well, I'll just start and say, after 29 years of being in the education realm, I still am wearing my rose-colored glasses and believe that this can actually happen for us. I still hold out that hope. I think we can do this. I think it's just going to take a collective group of us. And as Madeleine said before, it's going to take leadership at the helm who makes the big decisions and has that power and an opportunity to do that for us. So I'm ready and willing to help and support. And I just appreciate all of you for caring enough to stay on this Zoom and listen to us and help us. So thank you so much.
I will second that and just say that any conversation you have with anyone at this point in time, you can find some way in which they're being impacted by young children in their family, in their workforce, that there is a lack of access to care. And just to end on one final example, I had never thought that I would be standing trying to talk the importance of early care and education to labor unions. And initially, when the conversation started, there was a lot of blank stares. And then we mentioned wait lists for childcare. And it was all men. 3 men immediately sat up straight and was like, wait, my kid's on a wait list. And they were on wait lists that were so long that they weren't going to get off before they entered kindergarten. And that was something that, sometimes you just have to keep talking and then someone will start listening, because they'll find the piece of it that matters to them. The other piece for apprentices was they couldn't, for the labor, their apprenticeships couldn't take the classes that they needed to take because a lot of labor are single parents, and taking apprenticeship classes from 7 to 9 at night was next to impossible because they couldn't find childcare for their children. So I think that it is a place in which when you do, persistence beats resistance all the time. That is my motto. And that the more we talk about this and the more that we just don't give up, I think those rose-colored glasses are real, Lisa. And we will make the change within a time frame that will impact our families and especially our children's families.
Agree with all that. Thank you. And let us know how we can help.
Okay, I guess, Keda, anything else that you wanted to add before I close it out? Okay, I want to ask this whole group, if you can find the applause, the clapping icon on your reaction file, would you please give a round of applause, not just to our panelists, but Keda, you did a great job. Thank you so much. I just want to also thank Chrissy Galeen, Penny Diner, obviously Keda. We have a couple other committee members who were not on the call, but I want to thank everybody who has worked on this part of this project. And as I said at the beginning, this is the second of 3 virtual presentations. Please mark your calendars for March 20th. That will be on affordable housing. And then our culminating event at League Days, as Keda mentioned, and thanks for putting that slide up, on April 8th. I hope that you will all join us in Dover at Christ Church for our final and culminating session. I think that we have a lot of work to do in Delaware, but as I look at who's on this call, I think we can get that work done. And I took my rose-colored glasses off. I still believe that we can get it done. So thank you all for being here tonight. Please feel free to contact your your county leagues if you need more information, or the state league. I would tell you to drive safely when you get home, but it's that sentiment. Stay safe, stay warm, stay engaged, and join the league.